A bone excision is the removal of a portion or growth of bone. The medical term for this minor surgery is called an osteotomy, or literally, removal of bone. The procedure may also be termed a laminectomy, a term used to describe removal of bone from the lamina, or part of the vertebrae of the spine. Excision of rib, partial. The physician removes part of one rib. With the patient under anesthesia, the physician makes an incision in the skin of the chest overlying the rib. The rib is identified. The physician removes the desired part of the rib using a saw and other instruments. The remaining pieces of the rib and the wound itself are irrigated and debrided. The incision is sutured in layers. Excision first end/or cervical rib. The physician performs surgery to remove the first rib end/or an extraneous cervical rib. With the patient under anesthesia, an incision is made in the skin just above the clavicle on the affected side and carried deep to the rib. The rib is identified and the attached soft tissues are dissected from the bone. The physician excises the rib using a saw and other surgical instruments. The rib is freed from its articulation and removed. The wound is irrigated and closed in layers. A dressing is applied. Excision first end/or cervical rib, with sympathectomy. Report if a sympathetic nerve pathway is cut during the procedure. Excision of bone, e.g., for osteomyelitis or bone abscess, mandible. The physician removes infected or dead bone tissue from the mandible. This procedure can be performed intraorally through the mucosa or extraorally through a skin incision. If only a small amount of bone is affected, the physician may saucerize the area by grinding the dead bone away with drills or osteotomes. Healthy bone and the continuity of the mandible are left intact. Antibiotic-impregnated acrylic beads may be implanted into the surgical site to stop infection after the removal of bone. These beads are removed at a later time. Extensive bone removal in large sections or blocks may require a separate bone harvesting/grafting procedure to repair continuity defects. The incisions are closed simply. Excision of bone, e.g., for osteomyelitis or bone abscess, facial bone, S. The physician removes dead or infected bone from facial bones. A transoral incision in the maxillary buccal vestibule is the most frequent approach. Facial incisions would only be used for large lesions or for additional surgical access. The physician reflects the overlying mucosa, exposing the dead bone. Drills, saws, and osteotomes are used to remove the bone. The transoral incisions are closed in a single layer. Any cutaneous incision is closed in layers. Excision of Taurusmandibularis. The physician removes a benign outgrowth of bone, torus mandibularis, most commonly from the lingual, tongue, side of the mandible. Using an intraoral approach, the physician makes an incision in the mucosa overlying the outgrowth of bone and reflects the tissue. The excess bone is removed with a drill or osteotome. The mucosal incision is closed with sutures. Torus mandibularis is a bony growth in the mandible along the surface nearest to the tongue. Excision of maxillary torus palatinus. The physician excises a torus palatinus, a bony protuberance, usually found at the junction of the intermaxillary and transverse palatine structures, by making an incision through the mucosa overlying the protuberance. The torus is exposed. Drills, osteotomes, or files are used to remove and contour the bone. The tissue is sutured directly over the bone. Some soft tissue may be excised prior to closure for adaptation over the newly contoured bone. Excision, radial head. The radial head is excised in this procedure. The physician makes a longitudinal incision along the lateral aspect of the elbow. The elbow joint is exposed by freeing and reflecting the common origin of the extensor muscles. The joint capsule is incised and the radial head is exposed. The physician uses a bone-cutting saw to excise the radial head. The capsule is closed with sutures and the incision is repaired in layers with sutures, staples, and slash or strie strips. Excision distal ulna partial or complete, e.g., Darroch type or matched resection. The distal ulna is partially or completely excised. The physician makes a medial longitudinal incision to expose the distal ulna. The ulna is located subcutaneously and does not require much dissection. The periosteum is incised and reflected to expose the distal ulna. Drill holes are made through the ulna 2.5 cm above the distal head. The physician uses bone-biting forceps to complete the division of the bone and remove the fragment. To stabilize the free end of the ulna, the physician reefs, overlaps, the periosteal envelope and ligament. The incision is repaired in layers with sutures, staples, and slash or strie strips. Immobilization of the wrist is usually not necessary.